Hey future nurses, this Nclex test taking strategy will help you ace your nursing school exam, pass your Nclex, and guarantee you your license. Now let's go. The first thing Nclex is looking at is if you practice as a safe nurse. So think about patient safety first. When you are faced with case study with multiple choices, think which of these options guarantee my patient safety first. Which of these options take away harm or remove harm from my patient? And this will guide you in selecting the right answer. Okay, and the next one is when you are faced with prioritization question, think about your ABC, your airway, breathing, and circulation. Remember, never place anything above airway, because when the patient's airway is blocked, patient is dead. So airway, breathing, and circulation, apply that to the case study. But if that is not applicable to the case study, think about your Maslow hierarchy of needs. That is your patient's physiological needs first, which are basic needs like food, water, elimination, rest. Think about this and apply it to the case study. And this will help you to choose the most appropriate right intervention appropriate to the case study. And if that still do not apply to the case study, then think about your ADPI, your nursing fundamentals, right? Your assessments, your diagnosis, your planning, your intervention, and your evaluation. Think about that and apply that to the case study. And either one of these would help you sort a prioritization question. And you remember, when you're thinking about prioritization, also it's applicable to thinking about which of these do I need to do first to avoid my patient or to avoid sending my patient into critical condition. Okay, the next one is process of elimination. When you're faced with case study or with questions with multiple choices, eliminate the two first obvious wrong answers first, and then you are left with the two. Think about within these two, which of these options is the safest option to go for? Which of this option is the most appropriate? Now, this is where the challenge is. If both left options are actually appropriate intervention to do, think about umbrella answer. Umbrella answer means you doing one of them covers the other. Let me give you an example. You are educating, as a nurse, you are educating a newly diagnosed patient with diabetes, and the first option says, teach the patient to avoid sugary candy. Okay? Teach the patient how to check their blood glucose at home. The third option says, encourage the patient to attend diabetic education class. Hold up. Now, this third one has covered, when you think about it, if the patient is able to attend a diabetic education class, in that class, they will teach them to check their blood glucose at home. In that educational class, they will teach, they will encourage the patient to avoid sugary candy. So this is an umbrella answer. Even though these two options are appropriate teaching for newly diagnosed diabetic patient, but this is an umbrella answer because this covers everything. That is what an umbrella answer means. So you think about that, and that will help you to pick the most appropriate answer in that question. Okay, next strategy is do not rush. Read that question twice, because keywords like first, like best, like immediate change the whole meaning of this question, right? And while you are reading this question twice, right, please do not foreclose your mind to some answer. Maybe you read the question and then, oh, you read the first option, you read the second option, be like, oh, I know the answer. But guess what? If you had read the third and the fourth, you will say, oh my God, the third or the fourth is even more appropriate. So once you have foreclosed your mind to the rest of the options, you might likely pick the wrong answer. So do not foreclose your mind. Read everything, right? And at the same time, do not overanalyze. I promise you, and I'm telling you this, that Nclex will give you some questions that are actually just straightforward. It's just plain and simple. There is no overanalyzing. So do not overanalyze it. Some questions will just come to you as very cheap, and they are actually cheap. So do not overanalyze at the same time. So this will help you understand what the question is requiring of you and be able to pick the right answer. And the last one is look for keywords. Look for keywords like chronic, like acute, like expected, like unexpected, like immediate intervention, and this will guide your answer. Once you're able to understand those keywords, you know what the question is asking of you, and you will be able to pick the most appropriate answer. I wish you guys success in your job nursing journey, and I wish you the best on your Nclex.